Okay, we'll start first session of our Aptas Vichara Vinimaya. Let's start the discussion. So, before starting, we'll take the blessings from Lord Dhanvantari. So, by remembering Lord Dhanvantari, we are starting the whole event. So, without wasting much time, so before starting the event, let me explain what is Aptas Vichara Vinimaya exactly and why Aptas is taking initiative to do this activity. So there are so many issues being happening in the Ayurveda sector, but we are talking in ourselves, but in a public forum, we are not at all discussing such things. Means our thoughts should be reaching to the different people. So people should start discussing the issues to find the proper solution for it, and gradually we are taking different issues in this, and the first issue whatever we have taken is creating jobs after BAMS. So we always have a complaint that most of the students immediately after completion of their BAMS go for allopathy practice. Now this is a problem. To find solution, then after analyzing so many things, we could come to a solution that there should be creation of more job opportunities in the section in the BAMS or Ayurveda sector. So we are having this issue for the first session. So so many other guests will be giving their opinions, discussing their thoughts, and the first session is being presented by Vaidya Sri Harsha Kevitar from Sri Tulsi Ayurveda, Bangalore. So I welcome Sri Harsha Kevisar, and I request Miss Yukta to give an introduction about our today's guest. Over to you, Yukta.
Namaste. Sir was born and brought up in Bengaluru, graduated from Sri Sri College of Ayurvedic Science and Research in 2011, and postgraduate in Ayurveda Samhita from SDM College of Ayurveda and Hospital, Hassan, in the year 2014. And he is also well known for his proficiency in Ayurvedic consultation for neurological conditions, joint care, and pain management. He is known to be a competent physician having repute in treating chronic diseases through the basic principles of Ayurveda. He has successfully treated more than 7,000 patients through the modalities of Panchakarma. Apart from his clinical skills, he has fronted many innovative programs for the development of Ayurveda. He also has to his credit publication of research articles in national and international scientific journals. With his leadership and organizing skills, he intends to work towards creating scientific awareness about Ayurveda in general public and develop innovative mindfulness in the medical fraternity through integration. Sir presently is a managing trustee, RPM Ayurveda Foundation, and executive director, Center for Manuscript Research, RPM Institute of Indigenous Sciences and Research, Bengaluru, associate professor, Department of Samhita, Hillside Ayurveda Medical College, Bengaluru, chief consultant, Sri Tulasi Ayurveda, Bengaluru. Sir is also awarded with Agnivisha 2014 for outstanding performance in academics, and he is also facilitated as Best Alumni for contribution in the field of health sciences and education in Ayurveda at Samavai 2016. He also organized innovative activities in academic, literary, and cultural heads for undergraduate students and postgraduate scholars. I wholeheartedly welcome you, sir.
Namaste. Thank you for my introduction.
Thanks, Ms. Yukta, for the guest introduction. Now, without wasting much time, I request Vaidya Sri Harsha sir to share his opinion on the issue creating job opportunities after BAMS, and after presentation of sir, so we will be having discussion about his struggles and how he managed to establish so many things after completion of his BAMS, and all his journey we are going to see. So over to you, sir.
Thank you very much, Vaidya Sharad and Dr. Yukta, for introducing me. First of all, I would like to take the blessings of Sri Lord Dhanvantari and all my gurus who have made my journey possible till this way. And also to all the teachers, and also my juniors, seniors, and colleagues, and also my students who have inspired me to gain more and more knowledge in this in the field of Ayurveda. And also specifically, I would like to thank one of my teachers, Dr. Malika KJ, who has been my inspiration all through my years, through my studies, and also through my practice journey. So, without wasting much time, I would like to set up a context of this particular event. Now, as Dr. Sharad already has introduced the need for this particular issue to be brought up in this particular juncture, I would like to set up a context, and also make sure that what are the fundamentals of this issue. That is, why should we consider this as an issue, and what are the current problems which we are facing? Because when we say that there are some issues, that there is some problem in our faculty, or in our field as such, or in our fraternity, then we need to understand it properly. Only when we understand it in the right way, we will be able to meet the challenges one by one, or step by step, and also get away with that one by one, and also that will be easy for us to go ahead in near future. So with this issue, that is creating job opportunities after BAMS. So this is a very interesting topic, of course, and also a very worrying one, because we know that we are all job seekers, as graduates. For example, a BAMS graduate, after finishing his internship, he wants a job somewhere, or he also may intend to do some post graduation in a subject. But of course, many of them want to earn money. At the same time, we also see that what are the qualifications required, or what are the skills required for by a job seeker. That is very, very important. So whenever I see our students, when they come out of internship, many of them, like, at least if there are 100 students, and almost around 40 or 50 of them will be ready with the resume, but 50% of them will not have the resume. So the resume speaks about your qualification, of course, and your background, your biodata, but it also speaks about your skills. That is, what skills you have acquired during your graduation. So this is very, very important. So the requirements of a job seeker will be, one thing is qualification. Of course, we know that the qualification would have been attained, that is BAMS, Bachelor of Ayurvedic Medicine and Surgery. But what skills have been attained, that is a question mark. We do not or we forget usually to particularly mention the skills. That is the key skills. Many times the resume is copy pasted, and we see that I am equipped with clinical skills. That is what is listed. But what clinical skills, what kind of skills do you have? Do you have patient management skills? Do you have diagnostic skills? Do you have the skill to formulate the formulations customized for a patient? What kind of a skill do you have? That is very, very important. So listing of that, or detailing this, will be very important when we are seeking a job. So the expectation of the job seeker, one more thing will be gaining experience. For example, many of the graduates may not really want to earn money as soon as they come into the come out of the college. They would like to learn experience for further growth, so that they learn more and more things. They learn more and more skills. They acquire more knowledge. Of course, another secondary objective is to earn money. That is of course substantiated. But we also need to see that who are the job providers. Like, if you have to do a job, somebody should provide you a job, right? So who is the one who is providing the job? So the job providers may be anyone. It may be your senior also, it may be your teacher, it may be an organization, it may be a hospital. Anything may be a job provider, or it can be an online platform. Anybody who can give you some work is a job provider. So the requirements of the what will be the requirements of the job provider? That is how a particular organization or a particular individual becomes a job provider. So the requirements for a job provider will be whether it is qualification. No, the qualification is non-essential, because it may be anybody, it may be a platform, it may be an organization. So that is not important. Whereas skills, that is management skills, are very 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 essential. That is how you manage your employees. And also, most important thing is to create demand for the product or the service. So now if we come to the to our field, what is our service? Our service is to give clinical um, you know clinical practice. That is mainly the medicaments to be served to the society, one thing, or to maintain the health of the individuals. It may be general public, it may be specific specialities in which you are going to provide the specialty services, or it may be general ayurveda awareness also. It may be anything like that, or it can be nursing care, or it can be palliative care. Of course, you know that in our field, we can choose any of the services. There is one more section, that is we have certain products. That is, for the treatment whatever is required, we should have some products, that is some medicaments or equipments or paraphernalia. So the companies or the organizations which produce these paraphernalia or medicaments or formulations or service equipments, or even the essential services, that is enabled services, what we call, that is clinical enabled services, these also will be these are the organizations which provide jobs to BAMS doctors. So there is a need to create demand for their product or for their service. Only then they can market it and also hire people to do this particular work. So the expectations by a job provider will be one, to earn for sustenance, that is how to maintain the all the overall expenditures of that particular organization or the company, or that particular clinic or hospital or anything like that. Then earn for the further growth of the organization. First is sustenance, second is for the growth of the organization, they need to earn more and more. That is, the income whatever they get, it should be more than the expenditure. So that is what is the expectation by the job provider. Third thing is to earn profit. That is, it should, when it surpasses the a certain limit, then they make profits. Only then they can provide more and more jobs. Only then they can provide more and more opportunities for youngsters. Only then they can expand their services. Only then they can create more and more clusters in different towns or cities, or they can expand it in different ways. Only then they can give you perks. Only then they can celebrate events. All these things are very important, because we also need to understand that who are the job providers and what are the requirements and the expectations of the job providers when we are intending a job. So a job provider usually basically is a service provider, that is especially in Ayurveda, any Ayurveda services, that is the treatment services, or it may be product manufacturer. Product manufacturer means it can be medications, or it can be, as I said, service equipments, it can be panchakarma equipments, or it can be services, that is transport services or anything like that, or it may be online services like online platforms, etc., delivery, many things like that, or even online consultations. All these things also are products as such. So when we understand all these things, uh, how does a job provider earn? That is because only when a job provider earns, he will be able to give away jobs, or he'll be able to provide jobs to BMS doctors. So one thing is he will be selling the product, and second thing will be providing the service. So what does he basically expect from the job seeker or the BMS doctors? One, the he should be able to execute quality service. That is, of course there should be qualification, because without qualification he may not accept you as a employee. That is one thing, that is the criteria number one. The criteria number two, and the most important one, is the skill. That is, what skill do you have so that you become fit for that particular job. So that is very very important. Second thing is to create products. That is, it is not right to say that whatever you have already learned in your BAMS, only that should be used, or only that can be used for the present situation, because many of the things which you have studied in the syllabus may not be applicable in the present scenario, or for the for the society at that particular situation. For example, we did not have any idea about COVID, or how to tackle it, or how to manage it. But when the situation was such that we had to do, we had to take up this challenge. So then you need to have the definite skills or a skill set to adapt yourself to the situation and then create some products. Or create product means it can be formulations, or it can be anything. It can be diagnostic equipments, it can be service equipment, anything like that. Or even it can be a product like a consultation platform, or it can be a online consultation platform, it can be online counseling service, anything like that. So that becomes the part of the skill. That is only when you have skills, you can create more and more, you can create more and more products. Only then the job providers will be able to hire us and provide a platform for us to work under them. So the let us understand the ecosystem. That is, the BAMS doctor, of course, is very important because he is the person who links, who is a direct executor of the of this particular function or the machinery. That is, he is directly serving the clients or the patients or the consumers. Like if it is a service, then it is for the client or the patient. If it is a product, then we consider it as a consumer. So the service provider in between acts as a catalyst. That is, he regulates that. Because many a times what happens is a BMS doctor cannot directly go to the consumer or directly go to the client or the patient. So he needs somebody to monitor, regulate, or even manage or control this particular system. So this ecosystem is very, very important for us to understand. Where do we stay right now, and what is our situation? How is the present condition of this particular ecosystem? How is it interlinked? All these things are to be understood by us. So the issue, coming to the actual issue, that is creating job opportunities for BAMS doctors. Mainly we are speaking about the BAMS doctors as the graduates. We are not talking about people who have already acquired some special skills, like they have done their MS or MD in Ayurveda, or they have gone deeper into their academics or higher into their academics, and they are serving the society in a different way. We are talking mainly about the graduates. So we see that many companies, or any kind of establishments, are not hiring BAMS doctors much. That is, as we see, like for example, a BAMS doctor comes out after his college. We do not see that any companies, like any hospitals or establishments come and do the campus interviews. Very, very rare. Only in engineering colleges, or even in any other colleges, degree colleges, you can see the trend has increased. And earlier it was not there, but now you can see that there are campus interviews. That means there is a demand for the skill set what has been acquired already in the college. That means the students are already equipped with certain skills, and that's why job providers are ready to hire them at a very early stage. That is, as soon as they come out from the college. But why are the companies not hiring BMS doctors at that particular junction? That is because probably one reason is they do not have the definite skill set. That is, the BMS doctors do not have the definite skill set which is required by the society, or to create a product or create a service. That is one thing. Second thing is, probably we are not able to connect with the uh, job providers, because we lack poor communication skills or even soft skills. So we can see that the attributes of a vaidya is that daksha tirthartha shastrartho drishtakarma shuchir bishak. Of course, you might have seen many cases, you might have practiced with your seniors, or you have might have gained knowledge a little bit, but shastra artha vinishchaya, that is, how do you connect between the text to the present context, that particular skill should be there with the BMS doctors. Maybe that is what companies look for, or people outside look for. That is one thing. Second thing is also the dakshata, what we call, that is the communication skills, or the soft skills, or the confidence with which the BMS doctors speak, or they present themselves, is not much appreciable. That is why many people do not hire them at an early stage. They say that probably you can complete your MD or PG, and then probably you can acquire some skills and then come to us. This is the answer usually seen by many no answer which is given by many of the establishments. So therefore there is a disconnect. There is, the job seeker is going in a different direction, the job provider is also going in a different direction, because he doesn't want these BAMS doctors to be in his establishment. Why I am telling this is, for example, if you see product companies, for example, you see any of the pharmacy companies. In pharmacy companies, there are merely Ayurveda doctors, BMS doctors working. You have only even technical people. I'm saying, I'm not speaking about the people who do the physical work, the intellectual work also. For example, you have MSc biotechnology people, my MSc microbiology people who are working in all the pharmacies and not BMS doctor. Maybe there will be one or two BMS doctors for quality control or something like that. But even in the QC department, you can see that there are other people rather than BMS doctors. Even in many of the food related, or nutraceuticals, if you see, that is the companies which sell their product as nutraceuticals, that is foods which help in proper dieting or anything like that, or nutrients or nutrition, etc. There also you can see that BMS doctors are not there, because probably that skill is not inculcated in the BMS graduates. So this is one of the important points which we need to understand, because when we are seeking for a job, we need to have the proper skill or the qualification required for that particular job. So mainly I believe that skill is very important for us, because skill can enhance creativity. If the creativity is seen, then it creates demand. For example, we did not have the usage of mobile phone for a number of years, but in recent past, around 10 years, you can see that a lot of people are using mobiles. So that is the outcome. Because people are using mobile phones, there is a technology required behind that. Because there is a technology required for that, there are companies which are manufacturing that particular technology. So when companies invest in that, they need people to work on it. When they need people to work on it, they will look for people who have the skill to code that particular technology. So that is why there is a lot of demand for the jobs in the engineering sector. Therefore, the qualification, attached with, or always bound with skill, will give us will give us wings, you can say, because that will create a lot of demand. So, and whenever create is getting increased in the society, then this is a chain. There is backwards. You can see that people hire more and more people who have the skill set. So this is a chain. That is, the skill creates demand. The demand created will further nurture the skill and creativity of people. Therefore, we can see that now we need to create, if we need to create demand in the society, then we need to create skills in ourselves, so that once the skills develop, creativity increases. If creativity increases, there will be more demand. I'll give you an example for this. Swarna Prashna was a program. It was an idea with long back, around 20 years ago, when it was started. Uh, when this skill of you know creating a program out of the shloka. See, when a person, a PG scholar, while he was searching for his dissertation work, he found this shloka in the Kashyapa Samhita about Swarna Prashana. What he did was, he created that particular shloka, or he converted or transformed that particular shloka into an idea. So what was done was, he modified it a little. That is, he worked smart over that. He shared his ideas with his seniors and teachers, and made sure that it is converted into a program. Therefore, it was a particular structured program, wherein children were the children were told, or the parents of the children were told, that the Swarna Prashana will enhance their immunity, and also other benefits of them were explained. So whatever was told in the text, that was converted into an idea. Now we see that that has this creativity has created a lot of demand. Now everybody in India knows about Swarna Prashana. Almost many parents know that what is Swarna Prashana and how it will benefit their children, and many of them are into the program. So this is going on, right? So this has created demand. That is, if a new doctor opens his clinic, you can see that many people come and ask that whether you have this Swarna Prashana program in your clinic. So now this has created a demand in the public. That means what? When you acquire a skill and be creative, then that will create a demand over the years. So this is an example. Swarnaprashan is one such example. There are many such examples which we can take, and also we can create more and more creative skills in our doctors, so that it creates demand in the public sector. When the creation of demand happens, then the supply also should happen from the same field. Then of course this skill will get enhanced and the creativity also will get enhanced. So the things which we have to do here right now probably is like I'm here to kickstart this particular discussion. I'm just proposing some of my ideas, so that other doctors or other experts from this field can contribute to these ideas and also enhance these ideas and take this ahead. Of course, I'm just listing four of the ideas. The first idea of mine is that we need to have a robust dosha vinishchaya or vyadhi vinishchaya skill within us. That is, when we say definite skill set, the definite skill set should be uh, identifying the doshas or identifying the vyadhi, and properly standardized in a standardized way. We need to have a proper representation of the dosha or the vyadhi vinishchaya. If we do not have that, then it will be very difficult for our fellow colleagues or our other faculty members to understand that. Therefore we should have this particular skill set in a structured way. That is the first thing. Second thing is perfection in formulating the implementable plans for the samprapti vigatana. We know that samprapti vigatana meva chikitsa, that is what are people expecting from us, the outcome what the people are expecting from a BAMS doctor is samprapti vigatana. That is mainly they should be able to treat the disease, right? So when samprapti vigatana happens, how does it happen? The BMS doctor should be very very clear about how this happens. What is the flow chart, or what is the flow in which from the hetu, like from the nidana parivarjana up to the samprapti vigatana, how he is going to formulate that particular therapy plan. This is very very important. That should be very very structured. The third thing is the Dravya Gnana. We see that many of the BMS doctors do not know what they are prescribing. For example, if you ask many of the doctors, BMS doctors, what is the ingredients of Saptamrita Laha, they may not be able to tell explicitly. They will be some of them may tell a shloka, but they will not be able to read the ingredients or tell the ingredients properly, or they may not know what is actually used in the market. That is, many a times many substitutes will be used, but they will not know about that. So what is there in the market or what is there in the industry, that will not be known by many people. For example, now Bala Chaturbadika Rasa, now it is available in a syrup form by a company. The BMS doctor would have studied even in his internship about the Bala Chaturbadrika Rasa, but he will not know a syrup, the same medicine is available in a syrup form, which can be prescribed to the um, uh, you know which can be prescribed to the children. So this is very important. That is, he should have a connect with the industry. Only then he will be able to grow more and more in his particular subject. So Dravya Gnana is not only related to formulations or medications. It is also about each and every Dravya. That is, even general knowledge has to increase. Only when he has good general knowledge, he can become more and more smarter. He can connect with people and he can communicate better with people, and then go ahead. Only then people will get impressed by the doctor. Otherwise it is very difficult to go on with the society. If you do not connect with the society, it is very difficult for you to go ahead into the practice or also acquire a job. The fourth important thing is smarter ways of implementation of therapist techniques. That is, you should be able to formulate things in such a way so that people you know uh, take this or accept this in a very easier way. For example, I'll give you a very recent example. Very recently, there was in the Sharad Rutu. Now Sharad Rutu is going on. Earlier, there is just last month in the Ashvaja Masa Purnima, that is on the Sharad Purnima, we had I had in my clinic I had done a camp or a program wherein the Sharad Purnima, that is Shashanka Kirana Bhaksha, that was prepared. This is a shloka, or this is a medicament which is explained in Ashtanga Hridaya in the Sharad Rutucharya. So we say that Rutucharya has to be followed by people, but they cannot practice it right away. That is by their own. We should be able to, give them in a certain way. So when I did this on that day, I had in just around one day, I had around 100 registrations for the Shashank Kirana Bhaksha, which I had prepared on the Sharad Purnima night, and I had served it in the early morning on the next day. So this is very important. Converting an idea from the text to again bringing it to the people is very, very important. Then only you can earn things, right? So people are ready to spend. Only the thing is they should be able to find out a genuine person who is doing it in a genuine way, and also the expectation of the people will be that the outcome or the results should be substantiated in a proper way. Only then we can go ahead in this particular field. Otherwise, if you say that this is effective, non-effective, you just speak about it and do nothing about that, that is not going to create a lot of demand on the in the for years to go. So these particular strategies probably will bring the job seeker and the job provider together. Now, with this, I would like to give a statement that the job providers are not establishments for a BMS doctor. Job providers are not hospitals. Job providers are not the organizations, or job providers are not your seniors. Job providers are people, right? People are, or the general public is your job provider, and the job seeker, if he can connect with the people, definitely he can earn more and more, and he can progress by himself. So with this, I would like to thank Aptas for giving me an opportunity to share my views, and also of course we'll go on with the discussion about how we can implement these smarter rules. So let us think smart and act sooner. Thank you. Over to Dr. Sharad.
Thank you, sir. It was a very amazing presentation because you have shared some of the amazing ideas and have noted down the important points. The best one which I liked is people are the job providers. So this is a new insight which you have given, and I feel all must think in this way because, as you said, most of the BMS graduates will be having the idea that some of my seniors will help me in getting a job, or some of the hospitals will provide some job. But this particular idea of people are job provider is an excellent idea, and you have shared two beautiful examples, sir. One is idea of Swarna Prashana into a program was really inspiring for us, and Shashanka Kirana Bhaksha, which you have explained, it's really interesting, and the way of converting a shloka into an idea and then marketing this idea is really amazing. And I feel, and I also always tell my students in class that you should be very concentrating to the shlokas. So if you read and only translate the meaning, then you will restrict there itself. But if you can make it into an effective idea, then definitely you can bring. And as we all know, an idea can change your life. So it was very inspiring presentation, sir. And hope all our viewers will be following this, and they will be circulating these ideas among their students, or if some students are watching, definitely they will be motivated and their way of thinking will be changed. And as we know, the issue was creating jobs after BIMS. So this presentation, the first presentation, is very much important because sir has explained very neatly what are the expectations from a job provider and what are the skill sets we should have. So, and sir, Sriharsha sir, it was very interesting. So I have some questions to you, sir. Like,
Definitely.
sir, what were the thoughts when initially you completed BAMS? And I think definitely you have immediately joined postgraduate. So either after BAMS or after post graduation, what are the thoughts in your mind, and how you took firm decisions to design your life, sir? So please share some views on this, sir.
Yeah, this is a very important question, because I joined Ayurveda, especially during my BAMS. I was very much passionate about whatever I was studying. Rather than core academics, I was, much into, practical applicability of the ideas which were there in the Samhitas. So soon after my graduation, I had a few months, that is around 6 months. We had time because the counseling process takes a lot of time for the PG post graduation courses. Therefore, I had a 6 month period in which what I did was I actually joined a particular company, which was a Ayurveda and yoga organization. So there, what I did was, though I was paid very less, to be frank, I was paid only 5,000 rupees as my salary for my full time work. But what I did was I just took that as an opportunity. I did not, break my heart that I earn only 5,000 rupees from this, but I started, learning from that. What I did was there were people who were coming for the yoga, and what I did was I started a program for them about educating Ayurveda for the yoga students, because yoga has some of the aspects from Ayurveda also. Therefore, I wanted them to know about the actual or the genuine aspects of Ayurveda. So I started teaching them, or I created a program called, that organization was called as Atmayan. Atmayan, that was the name of the organization. So I started a sabha, or the group of discussion called Atmayan Arogya Sabha, and I invited them, and then I was giving lectures to them. So this I did by my own. When I did this, I started getting a lot of questions from them. I answered them, and also they also spread this word. So I became a little popular among that particular faculty, and even now, I see that I have patients. See, after around 10 years, I have patient, or 12 years actually. 12 years, I have certain, clients who are there worldwide, which who had come in contact at that time. Even now, I have had them as my clients. So this is very important for us to connect with the people. That's the first thing. Second thing, what I did was, not only during my internship days, in the first year itself, that is why when I was studying the first year BAMS, what I did was I wanted to know that, I wanted people, that is neighbors, relatives, friends, everybody, especially our neighbors, or who are general public. I wanted them to know that I am going to study Ayurveda, and what is Ayurveda, they should know about my field. So what I did was I made a question of around 15 questions, that is about awareness about Ayurveda. That is, what do they know about Ayurveda? What is Panchakarma? Whether Ayurveda is a genuine science or not? Such questions I just made a questionnaire. I went to each and every house. I was doing this on every Sunday. I used to select one particular street, go to their home, and introduce myself, because many of them knew me because I grew in the same area. So used to introduce to them, and then I would say that I have joined Ayurveda. Then they used to have a question mark, that what is Ayurveda? Why did you join this course? What will you earn from this? And all those things. Of course, I would have a general discussion, but at the same time, I would also give this a questionnaire, and that I would ask them that what do you know about Ayurveda in these years? Because being an Indian, you should know about Indian science. That was my vada. So then they started answering those questions, and then I got to know that how much they know and how much they do not know. And then I started answering to them. Whatever questions I did not know, I used to come back, ask my teachers, and go to them on the next Sunday and answer them. So this created a lot of confidence in them, that this guy is going to do something in Ayurveda. So when I started developing this confidence in my neighbors, this gave them confidence in me also, that yes, I can achieve something in this particular field. Then what happened was, later when I started my clinical practice in the same area, then people are now coming to me, and most of my neighbors know me as a doctor. They respect me. The people who were calling me by my name now call me by sir or doctor. So this is what is the difference it makes when you connect with people. You need, as a postgraduate or even as a graduate, you need to connect to people. If you do not connect to people by your own, by voluntarily, they will not come to you. for initially you will have to go to them, later they will come to you. So I think this is the way earlier also it was happening. Now you see that know that while studying the Charaka Samhita, we learn about Acharya Charaka. Acharya Charaka had no ego. That is why he was called as Charaka. Charate iti Charaka. That one of the vyututti of this particular name of Charaka is he used to go to people. So he communicated with people. When Acharya Charaka can go to people, then why can't we go to people? We are mere doctors, Ayurveda doctors who have studied a little bit of Charaka Samhita. So it is important for us to go to people, leave our ego. Especially when we are students, there should be no hesitation to connect to people. We should introduce ourselves to them. We should introduce our science to them, and then make sure that they come to us later. They will definitely come to us. Unless we introduce ourselves to them, they will not introduce themselves to us. So this is one of the key points which probably made my clinical practice successful.
Yes, sir. Sir, it was a nice journey. You have struggled a lot, and actually, we are expecting the same, sir. So, most of the times, we invite successful people and they share their story, but uh, we need that struggle, like how it was difficult and it is not easy to achieve whatever we have done. So definitely to achieve this, we have to put lot of efforts, as you said. And I hope all the youngsters who have finished their BAMS and who are always watching our this Vichara Vinimaya, they definitely have to give it a thought. Like, yes, I have to start from now to speak about Ayurveda. So most of the times, as I see, uh, people are not ready to talk about Ayurveda by themselves. So we have to initiate it, and definitely this is a really inspiring one. And we have one question, sir, in
Yeah.
YouTube
Yeah.
from Dr. Sayed. Hello, sir. My question is how to build skills, where to build skills, and how to create demand. I think you have answered how to create demand very nicely in the end of your presentation. So, if you could give some insight about how to build skills and where to build skills, it will be very much useful, sir. Over to you, sir.
Fine. Thank you for your question, Dr. Sayed. I would like to answer. I am happy to answer this because many a times what happens is we may not have certain skills. For example, communication skills or even speaking skills may not be there. See, we say that we need to speak up. But we may not be able to speak up. This I'm telling you because I was a guy who never spoke to people. I was popular as a very silent boy till my PU days. Only after I joined Ayurveda, I started speaking up. Only Ayurveda gave me the confidence to speak up. So when you have a lot of passion, I think that will give you a lot of energy. When you get that energy, of course you will start learning things. I don't say that I'm perfect in any language. I'm not be perfect in English. I may not be able to be perfect in Kannada or any other language as such. But the right way of communication comes from the energy what you put in or the passion what you put in your work. So that is very very important. That is the first thing. Second thing is to learn skills. Now there are a lot of platforms. When we around 10 years ago this was not there, but now you have the online platform wherein you can have you have many of the communication skills or the soft skills training which can be done freely. You have certified government run programs. For example, NPTEL, you might be knowing about that. Many of you been knowing about NPTEL. It's a national program for the e-learning, technological e-learning. It's a platform created by IITs and IIScs all over India. They provide the online courses. The courses are completely free, and uh, they mainly teach you the skills. They do not teach you most of the academic part. They are important for us to create skills in our profession. So there are a lot of courses there. You have more than 5,000 probably courses now, because over the years, in this around 8 to 9 years, there are a lot of courses which have been put up there. There are soft skill training courses. You can specifically search for NPTEL soft skill training course or enhancing soft skills. This will help us a lot. I also have done this course. After doing that course, I could get a lot of ideas how to present a PPT, how to make a PPT, I know how to even see. If you see this particular PPT also, earlier I used to prepare PPTs very randomly, but now you see that I have color coded it. Each the whole PPT is with yellow and blue color, right? So this is very important. To standardize things, we need to have certain fundamentals which we need to agree upon, and then go forward. That will give you a structure. Only when you structure things, your ideas also will get structured. If your ideas are structured, then your implementation will be structured. Your implementation is structured, then people will be able to take it in a easy way, and it will become more simple. Only when people accept it in a simpler way, then it will become more successful. Otherwise, if you make things complicated, it will go on getting complicated. That is why we there are many online platforms nowadays to learn these skills that you can acquire. Second thing is, you have to make the ideas. Whatever ideas comes into your in your thoughts, you need to pen it down. That is, you need to write it down in a diary and try to convert it or implement it. If you do not have the idea how to implement it, speak to your seniors. How did they implement it? Or speak to anybody as such, any random person. You can also speak to your your school friends who might have gone to different fields. They will give you ideas as how to convert your idea into an idea into a a completely manifested form. So this gives us a lot of the main important thing is the energy or the passion in which you work. That is very important. Of course, skill set you can earn and learn through online platforms nowadays, or you can also learn it in your college, from your teachers, from your colleagues, and also your parents.
Sir, we have one more question from Rohit Prabhu. Sir, how to avoid BMS students going towards allopathy?
Yeah, it is a very nice question, and I would like to love to answer this question because you see, I as a BMS graduate, or even during my BMS studies, I never went to a allopathy clinic or a allopathy hospital to learn. Even though things were difficult at that time when we were studying, I did not have that. I did not get deviated. Many of our friends went, but we did not go because. We already knew that there are a lot of opportunities in Ayurveda, and we had already, though we were not very clear of the implementation of the ideas, but we were clear that there are a lot of ideas which can be practically implemented, with which we can earn money. Therefore, we did not go there. So how to avoid is, you need to create opportunities. So what we need to do is, we need to call people, as seniors or as teachers. We need to call our students to our clinics. We need to engage them in our activities. Only if we engage them in our activities which are related to Ayurveda, then only they will get the confidence that yes, I can also do this. Otherwise, they will not get confidence that okay, one day I can do this and earn money, because they will be seeing, they should practically see that a senior or a doctor is practicing and they are earning and growing in their field. Only when they see this, they will get inspired and do this. Otherwise, they will get deviated towards, why do they go to the allopathy hospitals? Because you can earn money, nothing else. That is the ultimate aim. It's not okay. With some people want to know more things about the modern, the surgical skills or anything like that. That is fine. But if it is only restricted to that, it is fine. But if you are going as a duty doctor or just to earn money, then that's not the point, because that will not lead you to nowhere. So therefore, it is important for us, especially our young fraternity of Ayurveda, to inspire and also invite our juniors and our students, and involve them in the activities. Probably this will avoid them going to allopathy sectors.
It's a very good suggestion, sir, and I think this has to be carried. So, all the teachers or all the practitioners who are watching this live, please engage students. So, you show them the success stories that Ayurveda can do this, and don't hesitate in expressing whatever has been practiced. So, I think this is a good suggestion, and everyone will adopt it. And sir, we have some appreciations from stalwarts in our field. I think you know Dr. N. Anjaneya Murthy, sir.
Yes,
Sir
sir.
has messaged very good effort. This is ideal time to rejuvenate ourselves by these types of talks. So definitely from blessings of people like Anjaneya Murthy sir, this event will be going, and Dr. Mahalakshmi Hugar has told thank you for your time, sir. And one more question from Saubhagya Lakshmi Oja.
Yeah.
So how can we change the wrong thoughts regarding Ayurveda among the common people? As you said, people are the job providers. So this is one of the issue when we go for people. They have already lot of misconceptions. And to your notice, so many people are drinking water in the morning, sir.
Mm.
Uh, Actually, it is not advised in Ayurveda as such, but because of that, people have developed a lot of diseases, and I am educating so many of my patients. But when it comes to a larger scale, so there are a lot of such wrong informations about Ayurveda being spread. So how we have to tackle this issue? So please share your thoughts.
Yeah. Thank you so much for your question, and this is a very right question. As I said, that interacting with people is very, very important. Of course, on a mass scale, it is very quite difficult for us to, create. Of course, there are now a lot of, channels like Aptas, or even many of the youngsters, even Ayurveda graduates are also opening up a lot of YouTube channels. They are, giving the right ideas, and they are, educating the mass. But what feel is it should be more genuine. And one of these ideas which I implemented in my practice is that, see, for example, we treat patients who are suffering with diabetes, or for psoriasis, or for, maybe joint ache, or something like that, which goes on for many number of months or years even, right? So when a person approaches to you for diabetes management, of course he will be taking allopathy medicines also. Along with that, he is ready to take Ayurveda medications also, and gradually, probably, he hopes that he can, get rid of allopathy medicines and continue with Ayurveda. So with this intention, they come to you. So what I used to do is, in the initial days of my practice, to attract them, or to educate them, what I used to do is, I never used to give them the whole month of medications. That is, you prescribe and leave it to them. They will come after a month. I would not do like this. What I would do is, I would call them daily morning, because along for Prameha, you know that the Asya Sukha, Swapna Sukha are the important Nidanas. To avoid that, what I used to say, that you come to my clinic in the early morning at this particular time, you walk and come, don't use your vehicle. Please come by walk, and I will give you a medication. You have to take this medication. So what I used to do is, this the same Asanadi Kashaya, which you can prescribe as the kashaya in a bottle. I was to prepare it in my clinic daily, and administer them around 30 ml daily. They used to come by walk, and also take that fresh, and then go back home. This gave me a lot of results. That is one part of that. Second part is that every day, there is for I used to administer this for 30 days or 45 days. At least 45 days I used to do this. So 45 number of interactions will happen with this particular patient and yourself. So every time he comes to you, he will have some question, some interaction. He will ask about many things. He will see many things in your clinic. He will question about that, or he may ask you certain doubts about his diet, lifestyle, everything. So you have a 45-day or 45 opportunities to educate him. And otherwise, on a regular basis, if you just prescribe a medication and send him back, then you have only one opportunity. So the same opportunity can be converted into 45 opportunities when you can educate the patient freely. And at the same time, you can earn better also. For example, I would say, what I was to do is, I used to charge 50 rupees for the administration of the medication. So 50 into 45 days, or even if you give for 30 days, 1500 you earn. But if you prescribe Asanadi Kashaya, which is a 150 rupees medication, for the whole month, he may take, he may not take, he may not take it in the right way. All these things are there, and you also lose the opportunity of interacting with him. So now you have a lot of opportunity to interact with the patient, educate them freely, one thing. And also at the same time, you earn well. You earn almost 15 times than what you have what you could earn if you only prescribe the medications. So these are the ideas which are genuine. I don't say that it is I think some of them may disagree with me, but I don't feel that it is a it is an injustice made to the patients, because if you're educating, then there is nothing wrong in charging them. And probably 50 rupees per day might not be a very big thing for IT people, or people who are earning well. So you have to see the of course, the socio-economic status of the patients, and then start charging them. But you should not be overcharging, of course. But at the same time, you should never leave the opportunity to teach the patients. So this is very important, or this is an idea which can be transformed. Of course, now what can be done is to educate the mass. You can, if each and every youngster can start having their own Instagram reels, or they can do whatever they practice. For example, they practice abhyanga, they do vyayama, then they can just record a reel and then put it in the Instagram, or they can put it in the YouTube. All these things can be done nowadays with the help of online platforms, so that they reach to everybody. And the of course, one of the um, main objectives of aptas is also reach Ayurveda to each. So this also can be uh, very well established. Thank you.
Yes, sir. Sir, Prashant Bandi is asking, very nice and informative presentation, very much helpful for Ayurveda doctors. And
Thanks.
one more question by Manoj SM. So tell us about job opportunity for Ayurveda in abroad. I think this itself is a big topic which has to be discussed, because many of the students have these thoughts whether we have job opportunities, whether we can practice Ayurveda as a doctor, because in some of the countries Ayurveda doctors are practicing but not as a doctor, with some other names like lifestyle coach, and as much as I know.
Correct.
So if you know anything about this, please guide, sir.
As such, I have not explored too much about the job opportunities in abroad. I have not visited too many countries. Therefore, I am not the expert in this particular field. And I feel that we have ample opportunities in our country, our own place, our own locality, or our own community. I don't think we should leave our countries, or leave our places and go outside. If you ask me, I have not treated, or I have not interacted with all of my neighbors in my in my community or in my place. So when this is the opportunity which I have, like if there are lakhs and lakhs of people around me who are my clients, who can become my clients, then why should I go somewhere outside and search for clients? I think the skill and qualification whatever we have is much great, and it is enough for us to earn and lead our life here. That is what is my opinion. But of course, if there are any opportunities, of course we can have a different expert panel to speak about this, who have experience on this particular area. Kindly excuse me that I do not have much knowledge about this particular area of job opportunities in abroad.
No, that's okay, sir, because we are not exploring all the sort of things. And definitely, sir, your ideas and your journey is really inspiring even me also. So we have some more opinions and some more comments. So Ambika Aryu is telling to your previous idea that, as you have mentioned about the Asanadika Shire, like for 50 days, like people are going to come. So they have some opinion like, sir, patient are not willing to come for such frequency. So this is what their opinion. But I have to interrupt and answer this. So the thing is, sir mentioned initially that we have to understand the job provider. See, the job providers are the people, as sir said. So the job providers in Bangalore may not be same as the job providers who are in Haveri. So we
Correct.
have to understand the pulse of the people, and then we have to execute our idea. I think this can be the answer. So if you have any other opinion, please share, sir.
Definitely, you have answered it very rightly. Of course, you cannot, force anybody to take your ideas, but whoever agrees, you can do that. So you need to really, understand the pulse of the patient, and then this thing. I have not prescribed to each and every person. Those who are ready to do that, they'll come. Otherwise, other things work. So, but you should have the options. you should have option number 1, 2, 3, 4, 5. When you have more number of options, whichever is simpler and whichever is applicable, patients will choose that, and of course you will be benefited at the end of the day. So and also the patient also will be benefited. Of course you can categorize patients like that, and then tell them, see uh, it is our job to give the options to the people. It is their choice, that whatever choice they want, they can make it. Of course we should be open for everything. Thank you for the question.
Yes, sir. So, and Chandrakala ma'am is saying that very good information. Thank you, sir.
Thank you,
And
sir. Thank you, sir.
Madhumati Desai ma'am is having question. Sir, how to get permission to sell our own preparations legally? So, what is proper procedure for it? Sir, do you have any idea?
Yeah, this was a question which was asked every now and then. Of course in many platforms this is asked. Very good question and very important one. uh, uh, I have to make it clear that whenever we are manufacturing any kind of classical products, for example, if you are preparing Sitopaladi Churna according to a text or according to the classical text, or if you are preparing in vati lehe etc., which you are preparing in your own premises or the clinical setup, and you are dispensing it to your patients, then it is completely legal, because you have already the certificate, that is you are already a graduate who have done or who have undergone training in Rasashastra and Bhaishya Kalpana, which entitles you legally to manufacture and dispense the classical Ayurveda medications. You cannot produce anything on your own, that is own combinations, and give it a name and then start selling it. You can dispense. There are two different aspects in this. If you start selling things and you start distributing it, you make another person liable for that, and then you start selling it, then it is different. But if it is going only from your clinic and you are dispensing it and also charging some kind of money for that, that is totally legal. This has been verified also, even from the Ministry of Ayush and Department of Ayush earlier, many a times. The classical medication preparations can be dispensed from your clinic, that you are entitled to, and that is completely legal. Only patent medicines cannot be done in that way, or your own formulations. If you are doing, then you will have to get it licensed from the Ministry of Ayush or the Department of Ayush. That can be done.
Yes, sir. Sir, Vinuta H is having a question. Namaste, sir. How can we seek jobs in corporate Ayurvedic hospital apart from essential graduation certificate? What are the other qualifications required, sir? And thanks for this enlightenment program.
Thank you for your question, doctor. We in general, you can see that there are no much corporate Ayurveda hospitals. There are few, of course, there are few corporate Ayurveda hospitals, but as I said, see, there is there's no lot of demand. They are not hiring in large numbers. For example, if there is a corporate hospital, there will be a corporate investor for that. So the investor will give a responsibility to one particular doctor or a senior doctor, and that senior doctor, whoever believes in him, or whoever he believes, he will have a set of, or a team of doctors. He will hire some people, some key people, and then further they will hire one or two doctors, and then they'll run the show. So it is not a very huge opportunity. For example, if it is even a 100-bedded hospital, maybe around 20 to 25 doctors will be enough, not more than that. Because always the patient and the doctor ratio can be 1:3. Not, if it is a IPD setup, not beyond that. That is, if there are 100 patients, around 25 to 30 doctors are more than enough to manage the whole place. So you do not have mass recruitments in corporate hospitals. Only with and there are no many corporate hospitals. For example, in Bangalore you may have one or two hospitals which are serving this scale. Otherwise there are no much. There are OPD clinics, of course, but in OPD clinics, of course, there will be once again part-time jobs and not full-time opportunities. So therefore that is why I said that we may not have, the time may come wherein we have so much of demand, but right now there are no much corporate investments into Ayurveda. Only when there is a lot of demand, only then this corporate sector will enter into this Ayurveda field. So by then, probably we may have a lot of opportunities for Ayurveda graduates.
So with this question, I have some ideas, sir. Like
Yeah.
we have shown in our short film also, the short
Mm,
film Dr. Ayu Reach
yes.
Ayurveda to each. So
Yes.
even the first scene was the corporate scene. So definitely after 10 to 15 years, as the trend is going, all the corporate hospitals and all the normal hospitals also will be having a Ayurveda wing, and I believe this. But remember, students, if you if you don't have the skills to get a job there, and simply thinking about the opportunities may not be useful. So we should be always ready to gather the opportunities, and we should be ready with all the required skills for that activity.
Definitely.
So we have some more questions, sir. Sir, is it okay, sir?
Yeah, yeah, it's fine.
Okay, sir. So Ambika Aryu is asking, sir, we have very serious issue about practice of Ayurveda at town or villages. So how to overcome this challenge?
Yeah. As I said, of course, I am not from a rural background. Let me be clear about that. There are many other people, including you, Dr. Sharad, is has worked in towns and smaller cities. I think you will be able to explain or share your experience well. But of course, as I have seen, like in the um, a little outskirts of Bangalore, when I was exposed to, I see that there is a need for proper explanation and making Ayurveda more and more simpler. And we have the advantage of Ayurveda having a lot of history. So this is our advantage, one of the advantages. For example, if you see that allopathy, this was a challenge for allopathy practitioners also earlier. That is around 100 years ago, when Britishers came, and people, doctors became trained in different universities abroad, and they came back to India, and they had to go to the rural areas to serve. They had a lot of challenges to translate things into their language, that is the or and also convince them to take medications. But this challenge is not there with Ayurveda. You can translate many of the the practices of Ayurveda very easily to town people or the villages. Only thing is, you need to do the right way, and you should also know that it should be done in a novel way. You should not say that, for example, I had an experience one time. One of my colleagues, when we went to a village camp, we said that we had a talk about dinacharya. Then the first thing what the my colleague said was, you have to brush your teeth with neem sticks. Then a schoolboy who was studying around fourth standard, he stood up and said that he actually laughed and made it a mockery that work, being doctors, you are telling to brush with neem stick. Who will do that? Now we have herbal toothpaste, we have brush everything. It is so advanced, and you are telling to brush our teeth with neem stick. This is so obsolete. That is what he made a mockery out of it, and other students also started laughing about that. So you cannot directly tell whatever is there in the textbook as it is to the people. You should be a little smart enough. You should be innovative in reaching out the things to people. Only then they will accept it. So you have to give it in a different, or you have to repackage it. You have to say, give the same thing, repack it in a different way, and then tell it to them or explain it to them. That will be a wider opportunity. For example, I would like to give you example of the products which are sold in the market in the name of Ayurveda. For example, noni, or products which are based on millets. All these things, they are sold maximum in the town areas, not in cities. You can see that each and every villager will have a liniment or a pain oil or this thing, which are all based on Ayurveda. They believe that Ayurveda works for these things, but they always depend upon the advertisements. So if we can rightly point out, or rightly do some research on this, and then what are their requirements, what do they exactly need, based on that, if we are able to create some products and ideas, definitely they will be able to grasp it, and they will come to you. And villages and towns, it is known that they do not have much options. They will have to come to you only, like if once they know that you are genuine, and you have the service provider, they will definitely come to you. So you can have a long term relationship with them. So therefore, this is the point which is very, very important for us. We should not let the other companies or some other field people to overtake us with our products. So we should not let all these things, or Ayurveda based food products or Ayurveda based medicaments to go into the OTC products. It should not get converted into over the counter products. It should remain in our territory only. So for that, I think we need to work in the towns and villages only. Only then we will be able to do that. Of course, people who are staying in cities also should come, like doctors and Ayurveda Vaidyas should join hands with people who are staying in the towns and villages. And we have to help them to create awareness. I think organizations or NGOs like APTAS, and even we have APM Ayurveda Foundation, for which I am the secretary. We do a lot of programs based on this. We can join hands together. We can identify the doctors who are from the rural background, and then we can help them in creating awareness in their towns and cities. Thank you.
I have some points regarding this, regarding practice. As you mentioned, I may have some more ideas because
Yeah.
I'm practicing in town in
Correct.
Haveri.
Mhm.
So many people told me in the beginning that here without injection you can't manage. Yes, sir. So in rural area, people are really innocent. So and they can be, they are actually misguided by a lot of other branding companies. In the name of herbals, unnecessarily they are giving so many products, and in the name of network marketing. And I have seen in the locality of Haveri that in the name of network marketing, they are selling the product which is not at all required for their health, and after overconsumption of that, after so many years, they are developing so many diseases. Now nobody has answer for this, and nobody is blaming them. So what I believe is, if you can start educating about Ayurveda, definitely people will find you in rural areas also. And once they trust you, if you treat one patient properly, they will bring 10 of their relatives. And uh, even Haveri is a new place for me when I joined here. So in another month, I am going to complete my second year. And by now, I have treated around 60 patients in IPD. I have treated with Panchakarma. And even I have more patients in OPD also. I'm not telling that I have a lot of patients and I'm earning a lot of money. But yes, if you start, definitely this will going to, uh, this is a possibility. So unless you start, if you keep thinking whether it is going to happen or not, definitely it will not happen. You have to start, go to people and have to educate them. And once they develop trust, they will never leave you. So this is how it is working in rural areas and town areas. So one more question from Vinuta P. Torgalmat. So for practicing doctors, is there any platform so that they are updated with the uh, new knowledge or new methods of practicing?
Definitely a very good question. There are a lot of platforms nowadays. If you start exploring, you will get to know. You might be receiving a lot of messages also on many kinds of certificate courses, or a kind of enhancement, knowledge enhancement courses, even CMEs, which are happening every now and then. See, in every seminar or this thing, you may not find that each and every topic is interesting for you, or everything is a new thing. But you may be able to interact with many people. That will create a lot of confidence and energy in you. That is very important. So second thing is, uh, probably you can revisit your own texts. If you can spend around half an hour, or even 10 to 15 minutes with your textbooks, what you have already studied, because I am sure that you will not remember everything, each and everything what you have studied. And whenever you study your books, or when you revisit your books, you will get a lot of ideas. These ideas will inspire you once again, because you might have thought of those ideas in your BMS days, but may not be able to implement it, because you will have very limited knowledge about implementing it. But now you will have the skills to implement it, but many times you might have forgotten about those ideas. So it is always better to revisit our own texts, that is the samhitas especially. uh, I don't say that you should do a very deep samhita adhyayana or a parayana or anything like that, but you just revisit just glance through, you will get a lot of ideas, and your knowledge will get enhanced very well. So this is one of the aspects. Second thing is, you have platforms like, Hem Street is there, or Nirog Street. They also offer a lot of courses. There are a lot of courses from the Academy of Ayurveda, or you have in Bangalore there is a platform called Agnivesha Ayurveda Anushtana, who conducts monthly CMEs. You can attend there. You can also interact with many Vaidyas over the platform. There is a platform called ayurvedaconsultants.com. It has a network of a lot of doctors. You can put your questions and you get a lot of answers out of it. So these are the platforms through which you can learn more and more and update your knowledge. So I think Ayush also is coming up with this particular idea, and they may come up with a portal also for this. And I also recommend all of you to kindly go through all the portals of Ayush and also the CCRS, every now and then, so that you will get updated with the recent research or recent things, whatever is happening in the field. Otherwise, we will be disconnected with the updates of about Ayurveda. That is what I say. When you want to become the Daksha Tirthartha Shastra, then you should have general knowledge also. General knowledge should increase in our doctors. Only then you can enhance and upgrade. Thank you for your question. I think I have answered
Yes, sir.
satisfactorily. Thank you.
Okay. So one last question, and after that I have something to discuss with you. The last question is, sir, can you please tell that website about skill development? I think you have mentioned in your presentation, in your journey. So please tell about that, sir.
Yeah, it is NPTEL, that is National Program for Technological E-Learning. It is the government website. It's very very popular. A lot of people have done these courses. There are courses on research methodology. There are courses on humanities. If you go to the humanities section, you can learn about many things there. There is a course on Indian philosophy. There is a course on how the brain controls the mind. There is a course on that. There are courses on how to interact with people, how to enhance your soft skills. All these small courses. They are 8 weeks, 4 weeks, 6 weeks courses, which you can complete online. If you want to take the exam, you will have to pay the fees. You are nearby, there will be a lot of centers. You can go and attend the exam there, which will be an online exam. Usually it will be on Sundays or holidays. You can take the exam, and then you can get a certificate also, which is certified by IITs and IIScs, because these are the courses which are run by IITs and IIScs across India. So the website is NPTEL, NPTEL.
Yes, sir. And
Or you
Vinita,
also have Swayam courses. Swayam is it's also called as MOOC. Okay, Swayam is which was actually established, or it started by the inspiration by our Honorable Prime Minister Narendra Modi ji in 2012. It had initiated, and then in 2014 it got a lot of boost. And then from then, the Swayam courses are very very. And if you just Google as Swayam courses, you will get a lot of courses in each and every category. You can select anything and do that.
yes, sir. So Vinita ma'am is telling, I agree with you, sir. Thank you so much. And Dr. Anjanaya Murthy sir is adding a point for this. Lot of publications are from RIV. They can use by interested. So
Yeah,
with this, I think all the questions and appreciations in the YouTube are over. So before ending, I want you to give some insight about one of the wing of your APM Foundation, where you are all working for the translation of manuscripts.
yes.
So this is not known to so many people, and I think with this platform you can share the idea of that, objectives of that, and also you can give how that is how you are funding the researchers who are ready to work for manuscripts. Please, sir.
Definitely. Thank you very much for pointing out this. I would like to also thank Anjanay Murthy sir, who has joined this particular session and supporting us morally and also with his inputs. Thank you very much, sir. I would like to also share this point that Anjanay Murthy sir was the person who actually inaugurated the RPM Institute for Indigenous Science and Research. That is the research wing of RPM Ayurveda Foundation, which we started in 2018. Of course, RPM Ayurveda Foundation started in 2013 when we were students in SGM College of Ayurveda, Hassan. That is, when we were doing our postgraduate studies, what we did was from different specialities. That is, I was from the specialty of Samhita. Dr. Niranjan Hegde, who is the president or the chairman of the foundation, he is from Manasaroga department, that is specialty. And we have our vice chairman, Dr. Hemchandra Shetty, who is a Shalaki. He is basically from Madantiyaru, Mangalore. He has a lot of very good practice. He runs a OPD wherein his daily OPD numbers go up to 150. The average patient number of patients per day is 150 in Madantiyaru. It is a village actually between Dharmasthala and Mangalore. There he practices. And there are other other directors also. Dr. Divya Jyoti, who is once again from Mangalore. She is working in Karavali Ayurveda College, and she is a PhD holder. And she has done a lot of research in manuscripts. She has compiled a voluminous work on Kashyapa Samhita, the second version, the other version of Kashyapa Samhita. And we also have Dr. Nikhila Hiramit, who is a who also worked as ambassador for India. She is a Swasthavritta postgraduate and professor who works in Sri Sri College, and she also is one of our directors. She worked as ambassador for 2 years in Namibia for India, and now she is back. And we also have other doctors in our platform who join us for creating a lot of projects. So what we do is we approach these national institutes, like we have the Rashtriya Samskrita Samsthana in Delhi, which they fund for the manuscript studies. We have the NMM, that is National Manuscript Mission. They also fund for the manuscript studies. We have the Indian National Science Academy, who also funds for technological or the history of science. See, we see Ayurveda only as Ayurveda, but if you start seeing in a different perspective, it opens up new arenas. That is, see, Ayurveda is a science, right? So Ayurveda is a science which has a lot of history. So a science which is having the greatest history is Ayurveda. So if you see it in a historical aspect or from a history student's perspective, then there is a separate wing in history called history of science. So these people are behind the history of sciences. So Ayurveda, that is a very vast subject which opens up for us. So there are, you can create a complete career for history of science, especially history of Ayurvedic science, working on this. So based on that, we actually started this these manuscript studies, because when I was a postgraduate student, I started working on manuscripts, and then later many of them, as you know, that manuscript museum also is established now in SDM Hassan, which is very, very unique. In any Ayurveda college, we do not find this manuscript museum, especially Ayurveda manuscript museum, which is very, very unique, which actually started from our from the students. It started with the inspiration of Dr. Vaidya sir, and also Dr. Malika madam and Prasanna Rao sir. With their support, we could establish it up to that level. Later, now also we fund projects to different research scholars who are interested in translating the manuscripts, that is transcription and translation of manuscripts into English or even regional languages. Of course, we are not we are self-funding some of the publications. That is, if you anybody wants to write a book or want to translate something, we fund up to a certain limit, how much ever we can. But we also facilitate the funding through different organizations, as I mentioned, the Rashtriya Samskrita Samsthana or INSA or Ministry of Ayush, etc. Because you need to have a platform which has experience of handling such projects to deliver this. Otherwise, individually you cannot approach them. You need to have an organization, and then you have to go further. So RPM Ayurveda Foundation is such an organization which will support and enhance the skills, literary skills of the research scholars. Of course, we have different wings. We have the AISR, there is the RPM Institute for Indigenous Sciences and Research, which is a wing separately working in 3 different aspects. One is the literary research or the manuscript research. The second one is the clinical research, which is set up in Sagra, that is in near Shimoga. And the third thing is the Institute of Yoga, which is headed by Dr. Nikhila Hiramat. So these three wings are working in three different areas. That is the literary aspect, the clinical aspect, and the yoga aspect. So these three things. That is, we started with the inspiration of the avatars of Charaka. That is Acharya. Charaka is for Ayurveda. Mano Vak Kaya Doshanam Hatre Ahipate Namaha. This is for Mano Dosha we have yoga. For Kaya Dosha we have Charaka, and for Vak Dosha we have Panini. So on these three lines, we started this particular institute from Apyam Ayurveda Foundation to work on the Mano, Vak, and Kaya Dosha, to do the Nivarana of that and to establish research opportunities in this. So this is all about the Apyam Ayurveda Foundation and its activities. Thank you for giving me the opportunity, Dr.
Yes, sir.
Sharad.
Thank you, sir. So Ambika is telling I am a graduate and had confusion about career. It helped me. So definitely this first session of Vichara Vinimaya has helped to inculcate a thought that there are different perspectives other than searching a job.
Yes.
So as you can see the logo of our Vichara Vinimaya behind me. So that is having a symbol of battery. So whatever discussions is being done here should help to empower the thoughts. So this is what we have kept in mind and we have made that logo. So definitely this is the start of Vichara Vinimaya, and only with this topic we have now connected so many other topics. While discussing with sir, now I came with some more ideas like how we can get jobs in the field of research. So this can be a new topic under the main topic of this job opportunity after BAMS. And definitely in further sessions, we are calling some government officials who are policy makers, then who will be guiding that what government is doing regarding the job opportunity creation. Because as you know, there are so many colleges and now new colleges are also being opened, and there are a lot of doctors coming out, but everybody is not able to start their own setup. So definitely there is a requirement of creating jobs, and even government is trying to take Ayurveda globally, and definitely in coming days there are so many job opportunities which are being created. But as sir has said rightly, jobs will be available, but we have to develop those skills by which we can get those jobs. So this is the summary of the whole discussion today. So we have one more idea, Sriharsha sir. So whatever discussion is being done, so our team will be making a write-up. So and that summary of the whole discussion will be shared among the Ayurveda fraternity, and it will be published in all our social media handles also. So this was very nice talk, and even I have been inspired by so many of your thoughts, and definitely I will guide these thoughts to my students also, and all my colleagues, and definitely this video will be available in the YouTube forever. So those who couldn't attend the session, so for your information, around 45 to 50 people have joined the live stream, so which even we didn't expect it, because in this time everybody will be busy in their work. But I feel for the first session this is a good response, and definitely in coming days more people will be joining for this. And with this I thank wholeheartedly from the team of Aptas Ayurveda to Vaidya Sri Harsha KV sir from Sri Tulsi Ayurveda Bangalore. So definitely we will adopt so many of your ideas and will reach these thoughts to so many people. And I request all those who have watched the video to share the video for the community, so that they can have the different insights into the topic. So with these words, I conclude today's Vichara Vinimaya. And in coming days, we are taking up so many other issues which are burning issues of Ayurveda. So, and I have a request. If you have some good suggestions, those who can give good ideas for this platform, you can definitely message us for Aptas Ayurveda, or you can mail us, you can message us to the number, and definitely we will approach them to give a talk on the topic. And in coming days we are making some panel discussions also. At a time 4 to 5 people will be invited, and for a topic their thoughts will be discussed. So many ideas we have with Vichara Vinimaya, and this all could happen with your good response, and we don't have any monetary benefits with this. So we are doing only with the purpose of inculcating the good thoughts among the Ayurveda fraternity. So with these words, I thank Miss Yukta and Pandit, who has technically helped for the whole session. And I thank all the organizers of Aptas Ayurveda, and I conclude this session. Thank you, one and all. Thank you, sir.
Thank you very much, Dr. Sharad, and also all the best and congratulations for this initiation. Thank you so much.
Thank you, sir. Thank you.